Today we are going to start with the topic pit and fissure sealants. This is the first lecture on pit and fissure sealants. So when do we use pit and fissure sealants? When are they indicated? When the tooth is having deep pits and fissures but the tooth is not carious, non-carious teeth and non-cavitated teeth. Non-carious or non-cavitated tooth. If it is having deep pits and fissures, we apply pit and fissure sealant. Okay. Also, the tooth should be caries prone. Now we are going to see the types of pits and fissures which are present on the occlusal surfaces of the teeth. This was given by Anugano. Now, the first type is V-type pit and fissure. So the prevalence is 34% for V-type pits and fissures. Then the next one is U-type. So it is a little deeper and narrower. So its prevalence is 14%. Then we have the next one, which is I-type. So it is deeper and more narrower. This is the I-type of pit and fissure and it is seen in 19%. Then there is another one like this. This is the IK type of pit and fissure. So it is seen in 26%. Then we have the inverted Y type of pit and fissure. This is inverted Y. Inverted Y type. And its prevalence is 7%. Okay, these were the types of pits and fissures which were given by Nagano. Then for the V and U types of pits and fissures, which are little shallow and self-cleansable, the treatment is by non-invasive technique. Okay, for V type and U type pits and fissures. Then for IK and inverted Y type of pits and fissures, which are deep, narrow and retentive, the treatment is by invasive technique. Okay, invasive technique. For V and U type, it was by non-invasive technique because they were self-cleansable. Now we are going to read about the history of pit and fissure sealants. So firstly, in 1922 to 23, Hyatt gave a concept called prophylactic odontomy. Okay, so what they used to do in this, the fissures were filled with silver or copper oxyphosphate. Then, when the tooth erupted completely, when the tooth eruption was complete, they used to prepare class 1 tooth preparation. Okay, class 1 cavity was prepared. And then it was filled with amalgam. Okay, so this was prophylactic odontomy given by Hyatt. Next, in 1955, Bunocore, he gave the concept of acid etching. Acid etching. After that, in 1965, Bowen told about bis GMA resin. Bis GMA resin. Then in 1971, first pit and fissure sealant was introduced. It was a UV based sealant and it was named Nuva Seal. So first pit and fissure sealant was introduced in 1971. It was UV based and named Nuva Seal.